Good afternoon, Stephanie Joy. Just wanted to share, this is really for my mental health colleagues, mental health professional colleagues. Um, I was recently in a conversation with an acquaintance who had been under the impression that as a mental health counselor, she was not obliged to provide medical records, mental health records, when her patients requested same with a proper HIPAA request, signature, who they are, address, etc. So, but she had gotten wind that that might not be so. So we were talking about it. And so this is for her and anybody else it helps. The fact is, mental health professionals, whether you are a psychiatrist, psychologist, or a counselor, therapist, or anything in between, you are not relieved of your HIPAA obligations to provide access to records. Okay, flat out. I know it's a big misconception out there. So I just wanted to point you to, because there is an actual difference though. You get one little small carve out, which is important for you to know. And I think that carve out may have been what people misinterpreted, who actually didn't read the code and all that, to think that they had a total carve out. Now, in fact, when you do that, it's a HIPAA violation, and things could get a little tenuous for you with that. So let's just go to it. Okay, so if you go to, well, let me just explain first. HIPAA obligation, access to medical records, everybody's got to do it, right? But mental health professionals do get a carve out of psychotherapy records, psychotherapy notes, not the rest of the record set pertaining to treatment, okay? So if you go to 45 CFR section 164.501, that is definitions. And if you look up the definition of psychotherapy notes, and the reason why they put it in there is so that you know what that means, that you can refuse to provide your patient even if they ask for it with proper documentation. So I'm going to read this part to you. Psychotherapy notes means notes recorded in any medium by a healthcare provider who is a mental health professional documenting or analyzing the contents of conversation during a private counseling session or a group, joint or family counseling session. And that are separated from the rest of the individual's medical record. Psychotherapy notes excludes medication. So here's what it excludes. And this is where some were getting a little messed up with, because they didn't know there was an exclusion from psychotherapy notes. They thought psychotherapy notes meant all the mental health treatment. Okay. So psychotherapy notes excludes medication prescription and monitoring, counseling sessions, start and stop times, the modalities and frequencies of treatment furnished, results of clinical tests, and any summary of the following items: diagnosis, functional status, the treatment plan, symptoms, prognosis, and progress to date. So you can't withhold those. You can only withhold the contents, meaning the details of an intimate conversation. Perhaps when I think they're alluding to, if someone's talking about a really painful, detailed incident, it involves other people's names, all that kind of stuff. So everything else under HIPAA, you are obligated to provide within 30 days, okay, for each and every session. All right. So, but it's important to know, so you know which part. If you keep your psychotherapy notes in a separate section from the rest of your treatment records, that might be the easiest way to quickly provide what you need. I know some knowledgeable mental health professionals who will just redact out because they don't have them totally separated, but they will just redact out. They have it like in a paragraph section, and they will redact that part out. But for those that have it separated, it's super easy, because then it's just that one main page that has all of the, the mental status exam, the mood, the affect, the demeanor, the speech pattern, the appearance, if someone's hygienic or looking disheveled. Did I say mood? angry, tearful, tangential, rapid speech, slow speech, physical movements, all those kind of things. So anyway, just wanted to give that to Jeanette. Thank you very, Jeanette, for bringing it up. So that is the section that gives you the definition of psychotherapy notes and what is not psychotherapy notes. So you knew what you have to comply with, so you don't get yourself in a bind with the Office of Civil Rights for a HIPAA violation. Okay, hope it helps. Bye now. If I can find out how to buy it now. See you guys.